I have a two-part question. The first is, what would be your priorities for the healthcare reform debate? And second, how would you engage community health centers and clinics to ensure that every individual is covered regardless of their immigration status?
Thank you for asking that question. You know, I just left your boss, Caso de la Rocha, one of our great leaders in healthcare, for delivery. I just left him very generous with his support. And I talked to him about healthcare and healthcare delivery. I ran a healthcare union, led a strike of nurses in 1991 to make sure that every worker had healthcare in the county of Los Angeles. I've negotiated contracts that have impacted thousands and thousands of people. In the legislature, I wrote the expansion of Healthy Families and Medi-Cal. I'm the author of the Cedillo Community Clinic Act. In addition to that, I've been working on how to deliver healthcare to mobile communities. I've been a member and a board member of the U.S.-Mexican Health Initiative and the Health Initiative of the Americas, because there's a challenge with respect to the delivery of healthcare to communities that are mobile in this global economy. The fact of the matter is, disease knows no border. And healthcare delivery is critical to our economy, but also to the national spirit of our life. I will work, as I talked today to your boss. The president was right. He's an early endorser of the president, campaigned for him in 3 states. He was absolutely correct. In here, everybody's for universal health care. There is no dispute to that. The question, the challenge before us is, how do we get there? How do we create the infrastructure, the accessibility, the availability of the delivery of health care that's culturally sensitive, linguistically responsive, and available and accessible? I worked with your organization, the Community Healthcare Clinic Association, in their legislative of the year. I've worked to do that my entire career, both in the union, when we created the public-private partnerships, and worked to save the general hospital and all the clinics, and create the public-private partnerships with President Clinton, brought $1 billion here. But in addition, working with the initiative in other countries, not just Mexico, but other countries of Latin America, I've worked to make sure that we have that infrastructure in place, because that's critical. Because the fact of the matter is, if you know this, if there's not an infrastructure, it doesn't matter that you have insurance. We don't have an insurance problem. We have an accessibility, affordability, availability crisis in the delivery of healthcare in this nation. And so that would be my work. It would continue, because that was the vision that was articulated by President Obama. And that would be my work, is to continue to work with him, with these organizations, nationally and internationally, and to make sure that we create the infrastructure. Now, my vote record is clear in defense of immigrants in the legislature, and I would not vote for any healthcare delivery system or proposal or what have you that did include immigrants, regardless of their immigration status. I won't do that in the legislature, and I won't do that in Congress. I will fight to make sure that everyone has health care, but I will fight effectively to make sure we have health care from the beginning until we reach the goal of universal health care. Thank you very much.
Well, thank you, Marie, for asking that question. And thank you for having such an outstanding nonprofit, Ultimate, which does incredible work in the 32nd Congressional District. In fact, it is a true resource to the residents of that district. I know because I visited the clinic, and I've seen the long lines of people waiting for care. Because of that, I knew that I had to support the efforts of community clinics such as that, and that's why I did sponsor bills to make a community clinic a primary provider in the Medi-Cal system, as well as in the Healthy Families system. And I thank you, because the California Community Clinics then honored me as their Legislator of the Year. Well, why are community clinics so important? Because they provide the culturally sensitive kinds of services that immigrants really need. And they are the ones who are in tune with the needs of the people of that clinic. And so I will do everything that I can to make sure that we have funding for community clinics, particularly in the San Gabriel Valley, which is at greater risk. Actually, 1/3 of the residents of the San Gabriel Valley do not have health insurance. What we need to do, of course, is to work for a universal healthcare system. That is really the solution. And I vow that is what I will work towards. It is important for every American to have healthcare insurance. It is important to make sure that everyone can have the comfort of knowing that they can get sick without going bankrupt. And so that's why we must make sure that everybody can buy into a system that is affordable, that has good coverage, that nobody will be denied because of a pre-existing health condition, and that we will work on prevention of such diseases as diabetes and high blood pressure. It is important to make sure that healthcare is considered a right and not a privilege.
Yeah.
Thank you for the question. I think we all agree here on the universal healthcare coverage, on that community clinics are good. We agree that we need to focus on preventative care. But one thing that we're not sure of is how to fund it and how to actually make it pass. Federal legislation has been tried over and over, but we really haven't focused on it, since the early 90s in terms of real comprehensive healthcare reform. To answer the question about documented or undocumented, we need to pass comprehensive immigration reform so that there's a path to citizenship and everyone is documented, so we don't even have to worry about that problem. I think a lot of times we end up focusing on the problem that we see in front of us, and sometimes we don't dig deep enough and to figure out what's the root causes. Now, passing healthcare reform should not put us in a budget deficit, and passing healthcare reform shouldn't put us in a situation where now the whole economy is impacted. We do need to work towards universal healthcare coverage, but we need to understand the cost controls, we need to understand the incentive structure that insurance companies are in right now, and whether it's public or private, or a mixed market, we need to go towards it, and we need to make sure that it's balanced, and that the rest of the equation is included.